Welcome to the training session on weekly COVID-19 vaccination data reporting for inpatient facilities. My name is Elizabeth Kyle, and I work with the Division of Healthcare Quality Promotion at CDC. There are 3 objectives for today's webinar. The first objective is to review frequently asked questions about data reporting. Next, we'll go over data entry topics, as well as tips facilities can use when navigating the Nhsn application. At the end of the presentation, we'll review resources on COVID-19 vaccination data reporting that should be helpful to facilities. Please note that today's slides have been put together by various members of the Nhsn vaccination unit. First, let's start with going over some general questions. So some facilities had questions about the monthly reporting plan. Facilities will need to create a monthly reporting plan before entering vaccination data for a particular month. The monthly reporting plan indicates to the Nhsn system which modules and protocols a user intends to follow for surveillance purposes in a specific month. The plan must be completed before data are entered for that month. Monthly reporting plans must be created or updated for healthcare personnel, COVID-19 vaccination summary reporting. So in other words, vaccination data must be in plan for data to be shared with the Centers for Medicare and Medicaid Services, or CMS. If facilities would like to create a monthly reporting plan, they should be sure that the No Modules Follow This Month option is not selected when attempting to create a plan in the application. This slide reviews how to report cumulative COVID-19 vaccination data. To do so, facilities report the total number of individuals at the facility for that week. Of these individuals, facilities should report the number who have ever received COVID-19 vaccination at the facility or elsewhere since it became available in December 2020. It's important not to limit reporting to just individuals who are vaccinated that week. Instead, be sure to report the cumulative total of all individuals who have ever been vaccinated to date. So for example, 50 healthcare personnel received only dose 1 of the Moderna COVID-19 vaccine during the first week of reporting. During the second week, 5 more healthcare personnel received only dose 1 of the Moderna COVID-19 vaccine. Therefore, the facility should report that 55 healthcare personnel received only dose 1 of the vaccine by the end of the second week. For additional examples, please review a quick learn demonstration on cumulative data reporting using the link on the slide. Sometimes there are not any changes to the COVID-19 vaccination data from week to week. In these instances, if there are no changes to your data, for example, there are not any changes in the number of individuals in their vaccination status, then simply report the same numbers as the previously reported week. However, please note that because there could be new healthcare personnel joining or leaving the facility, the vaccination coverage could change, even though no new vaccines are given. For instance, during week 1, 100 healthcare personnel may be at the facility, all of whom received a 2-dose vaccine series. During week 2, 5 more healthcare personnel joined the facility. However, these healthcare personnel have never received any doses of the COVID-19 vaccine. In terms of counting healthcare personnel, facilities should report COVID-19 vaccination data on personnel who are eligible to have worked at the facility for at least 1 day during the week of data collection. This is regardless of clinical responsibility or patient contact. We've included a few examples to illustrate this. John, a pharmacist employee, is included in the data since he is scheduled to work in the facility each Monday, Wednesday, and Friday. In the second example, facilities would count Nurse D in their data because she regularly works in the facility twice a week, Monday and Wednesday. In example C, Sarah is counted as she is a student performing clinical rotations in the facility every Thursday for 2 hours of the same reporting week for the next 8 weeks. In the final example, Joe is a contracted physical therapist who works every Tuesday in the facility for the next 16 weeks. Therefore, he'd be reported in the data. Another question pertains to if facilities should count healthcare personnel who always work off-site, remotely, or out of state. These individuals would not be included in the data, since facilities should only include those who are eligible to physically work at the healthcare facility. In the example on this slide, Caroline would not be included in the facility data since she performs all of her work remotely. It can be common for an individual to work in multiple facilities. In these cases, all eligible individuals must be counted at each facility where they work during the week of data collection. This is important since these reports describe vaccination rates among individuals working at a specific facility. So if an individual is scheduled to work at least one day each week at 3 separate facility locations, then that individual would be included in the data for each of the 3 facilities. We have also received questions from facilities about how hospital units and departments should be accounted for in the data. Acute care facilities should follow the guidance to make determinations in these situations. So facilities should include all inpatient units and departments of the acute care facility, sharing the exact same CMS certification number as the acute care facility, regardless of distance from the facility. Facilities should also include outpatient units and departments of the acute care facility, sharing the exact same CCN as the facility, regardless of distance from the facility. However, facilities should exclude all inpatient and outpatient units or departments of the acute care facility with a different CCN, even if they're different by only one letter or number from the acute care facility. In terms of reporting vaccination data, there are some questions on how to categorize individuals who received a COVID-19 vaccine that is not Food and Drug Administration or FDA approved or authorized. An example would be AstraZeneca. In these cases, individuals who received all recommended doses of the COVID-19 vaccine that is neither approved nor authorized by FDA, but listed for emergency use by the World Health Organization, should be counted in the unspecified manufacturer category, or question 2.99, if they provide documentation of vaccination. Please refer to the CDC guidelines listed on the slide for the complete list of COVID-19 vaccines that have received an emergency use listing from WHO. Sometimes individuals are granted a religious or personal belief exemption to COVID-19 vaccination according to their facility's policy. Facilities have asked about how to categorize these individuals. Please note that an individual who declines to receive vaccination for any reason other than the medical contraindications listed in the CDC guidance should be categorized as declined to receive COVID-19 vaccination for question 3.2. This is true even if your facility permits religious or philosophical exemptions for COVID-19 vaccination. This slide covers who is considered eligible for an additional dose or booster dose of the COVID-19 vaccine, according to the latest CDC guidelines released this month. Facilities should refer to CDC's interim clinical considerations for use of COVID-19 vaccines currently approved or authorized in the United States to determine individuals who are eligible to receive additional doses or boosters after receiving an initial completed vaccination series. Those eligible to receive an additional or booster dose vary by factors including vaccine type, age, location of residence, underlying conditions, and occupation. Now we'll review a question we received about the Nhsn application. Several facilities have asked about how they should update the facility administrator in Nhsn. Nhsn highly recommends that if there is a change in the Nhsn facility administrator, he or she should transfer that role to another user prior to leaving the facility. If the previously designated Nhsn facility administrator has left your facility prior to reassigning that role to another person, you will need to reach out to the Nhsn help desk to have that role manually reassigned to the new administrator. You can request this reassignment using the Facility Administrator Change Request form using the link on the slide. Please do not re-enroll the facility in Nhsn. After the help desk completes their reassignment, the newly designated facility administrator will be able to start the new Nhsn user onboarding process. Let's now focus on how facilities should categorize healthcare personnel. There are 4 main categories of personnel that facilities are required to report on. Employees are defined as all persons receiving a direct paycheck from the facility, regardless of clinical responsibility or patient contact. The second category consists of non-employee licensed independent practitioners, specifically physicians, advanced practice nurses, and physician assistants. The third category consists of students, trainees, and volunteers aged 18 and older. The remaining category is other contract personnel. Please note that facilities should refer to the tables of instructions for complete definitions of categories before reporting data. Let's look at some examples that have been servicing regarding employees. Facilities should include employees in the data who do not provide direct care to patients, but meet data reporting criteria. So for instance, environmental services employees who regularly work in the facility each week, but do not provide direct patient care are counted in the data. Also, front desk staff who are employees but do not provide direct care are counted in the data if they are eligible to work in the facility for at least 1 day a week. Please note that facilities should count healthcare personnel having official responsibilities in the facility, such as attending regularly scheduled meetings or required training. Some individuals who work on a pro rata PRN basis. A few examples are listed here to illustrate scenarios on whether to include these individuals. For example, if a PRN employee works every Tuesday of each week, then that individual will be included in question 1 for the current reporting week. However, if a PRN employee is eligible to work once every 4 to 6 weeks, then this individual will not be included in question number 1. This slide covers how to categorize employees who are on vacation or leave. Individuals should still be included even if they are on temporary leave during the week of data collection. Temporary leave is defined as less than or equal to 2 weeks in duration. In example A, if Susan is on maternity leave for 3 months, then she should not be included in question 1 for the current week of data collection. However, John, the facility administrator, is on medical leave for less than a week. Therefore, he should be included in question 1 for the current week of data collection. So now let's look at questions surrounding non-employees. The licensed independent practitioner category consists of physicians, advanced practice nurses, and physician assistants who are affiliated with the healthcare facility but are not directly employed by it. In other words, they don't receive a paycheck from the facility, regardless of clinical responsibility or patient contact. Post-residency fellows are also included in the category. Please note that advanced practice nurses include nurse practitioners, nurse midwives, clinical nurse specialists, and nurse anesthetists. This slide presents examples of individuals who are categorized as licensed independent practitioners. For instance, if a physician comes into facility A each week and is not paid directly by the facility, the physician will be counted in the licensed independent practitioner category. In turn, if an advanced practice nurse comes into facility A each week and is not paid directly by the facility, he or she will also be counted in the licensed independent practitioner category. The adult students, trainees, and volunteers category is a required field in the module that is defined as medical, nursing, or other health professional students, interns, medical residents, or volunteers aged 18 or older, affiliated with the healthcare facility, but not directly employed by it. Again, this is regardless of clinical responsibility or patient contact. Here are two examples of adult students, trainees, and volunteers. Resident A is an adult student who is not directly employed by the facility, but performs rounds on patients at least one day each week. Individual B is a volunteer not directly employed by the facility, but performs clerical tasks at the front desk at least one day each week. The final category, other contract personnel, is defined as persons providing care, treatment, or services at the facility through a contract who do not meet the definition of any other required denominator category. Here are two examples of other contract personnel who would be included in the data. In the first example, we see that Mary is paid through a contract. She works in the facility as a non-advanced practice nurse twice a week. Therefore, Mary would be included in the other contract personnel category. In example B, we see that John is paid through a contract. He works in the facility as a speech therapist once a week. Therefore, John would be included in this category. This slide covers the topic of if facilities should include vendors or sales representatives. These individuals are not considered to be healthcare personnel, since their primary role is to sell a product rather than to provide care or services. Therefore, vendors should not be included in your summary data reports. Now we'll go over a few slides on data reporting programs. COVID-19 vaccination coverage among healthcare personnel is an Nhsn measure for endorsement by the National Quality Forum. The measure is defined as a percentage of healthcare personnel who received a complete COVID-19 vaccination series. For example, healthcare personnel who received 2 doses of the Pfizer or Moderna vaccines or 1 dose of Janssen are considered fully vaccinated. Data on additional and booster doses are required in the Nhsn application and help to inform public health response. The measure refers to data submitted for employees, licensed independent practitioners, and adult students, trainees, and volunteers. These categories constitute the all-core healthcare personnel field on the data collection form. For information about CMS reporting requirements, please see the links on the slide. So beginning on October 1st, certain facility types that are part of the Inpatient Quality Reporting Program will need to submit COVID-19 vaccination data via the weekly COVID-19 vaccination module 1 week a month to fulfill CMS reporting requirements. Facilities can select any week within the month to report data. Facilities may choose to report these data weekly. COVID-19 vaccination data should be submitted by the end of the quarter as defined by CMS. Facilities can contact CMS with questions about reporting requirements using the email addresses provided on the slide. Now we'll go over a few points about reporting data for inpatient psychiatric facilities, or IPFs, and inpatient rehabilitation facilities, or IRFs. If your freestanding facility is not enrolled in Nhsn, you must designate an individual to be your Nhsn facility administrator and then complete the 5-step enrollment process. If your facility is already enrolled in Nhsn, you must get in contact with your Nhsn facility administrator and ask him or her to activate the healthcare personal safety component. If you're unsure about your facility status in Nhsn, please email nhsn@cdc.gov for more information. Once a facility has activated the healthcare personal safety component, IPF units reporting data separately from the acute care or critical access facilities must have their location added within the Nhsn facility. Please see the link on the slide for further instructions on adding locations. The same applies to IRF units reporting data separately from the acute care or critical access facilities. Units must ensure that locations are mapped within the freestanding facility. Again, the link on this slide will provide further instructions on adding locations. One common question we've received on reporting data for IRF units is as follows. I am reporting data for an IRF unit that is physically located within our acute care facility. The IRF unit has the same CMS certification number as a hospital, except for an RRT in the third position. How should I report the IRF unit data in Nhsn? Please note that COVID-19 vaccination summary data for healthcare personnel working in this IRF unit should be reported separately from the acute care hospital summary because the unit has a different CCN. You would need to add a separate monthly reporting plan for the unit. Once you're on the data entry screen, you use the drop-down box under the location field to enter separate data for your unit. Healthcare personnel eligible to work in the IRF unit should not be counted in the summary report for the rest of the acute care facility unless they are also eligible to work in other inpatient or outpatient units of the facility. Please refer to the training slides for COVID-19 vaccination modules for more information. Another question is, there are multiple IRF units located within my facility. Should I report COVID-19 vaccination summary data separately in Nhsn for each individual unit? In this case, the answer is no. The healthcare personnel COVID-19 vaccination summary data of each individual IRF unit should be combined and submitted to Nhsn as a single summary data report, combining all units within the facility. Now let's move into the second part of the presentation on data entry. There are two main ways facilities can enter data. The first is to manually enter data into the application using the data collection form. The second way is to upload data through CSV files. For information about CSV upload, please review the guidance using the link provided on the slide. We'll now review some tips for data entry, focusing on the data collection form. Some facilities have received the error that the sum of individuals reported for questions 2 and 3 must be equal to the number of individuals reported for question 1. This error is generated when data are entered for questions 2 and 3 that are greater than or less than the total number of individuals reported in question 1. Specifically, the sum of individuals reported in question 2 and question 3 must equal the total number of individuals reported in question 1. It's important to manually sum the values entered for all fields in questions 2.1 to 2.99. The any completed COVID-19 vaccine series total that is auto-calculated by Nhsn for question 2 only includes individuals who received a complete vaccine series. Since this does not count individuals with partial vaccination, relying on this total will likely result in an error. In this example, the user totaled the numbers in question 2 and 3.1 to 3.3. You can see that the numbers equal the total number of healthcare personnel reported in question 1. In this example, the user should remember to include the data entered for individuals receiving only one dose of the vaccine to ensure that the data entered for question 2 and 3 equal the number listed in question 1. A user will receive this error when the number of individuals reported in question 4 as being eligible to receive an additional dose or booster is greater than the total number of individuals reported as receiving a complete vaccine series for question 2. The total number of individuals reported in question 4 as eligible to receive COVID-19 vaccine cannot exceed the total number of individuals reporting in question 2 as having received a complete vaccine series. This is consistent with the eligibility requirements per CDC guidelines. An individual who has received a complete vaccine series has received dose 1 and 2 of the Pfizer or Moderna vaccine, or a single dose of the Janssen vaccine, or received a complete unspecified vaccine manufacturer. This is auto-calculated by Nhsn and displayed as the any completed COVID-19 vaccine series. A user will receive this error when the total number of individuals reported in question 5 as having received an additional dose or booster is greater than the number of individuals reported in question 4 as being eligible to receive an additional dose or booster. Please note that the total number of individuals reported in question 5 as having received an additional dose or booster vaccine must be less than or equal to the total number of individuals reported in question 4 as eligible to receive an additional dose or booster vaccine. Since question 4 and 5 are required fields, a value must be entered for each of these questions for the form to be saved successfully. If no individuals have received a booster or additional dose of the vaccine, a 0 may be entered for question 5. This will allow you to save the form. In this example, an error is not generated since the numbers entered for question 5 do not exceed the numbers entered in question 4. We would also like to review how users should report all COVID-19 vaccination by manufacturer type. The Nhsn application allows for vaccines by multiple vaccine manufacturers to be reported in a single data collection form. To enter data for more than one vaccine manufacturer, you would need to select the COVID-19 vaccine from the drop-down box. For step 2, you would need to enter the cumulative number of individuals who received only dose 1 of the vaccine. Next, enter the cumulative number of individuals who received both dose 1 and 2 of the vaccine. If some individuals received another type of vaccine, then return to the drop-down box and select another vaccine and repeat steps 1 to 3 as described. It's important that facilities view their saved data. Data can be viewed by navigating to the calendar screen on the vaccination summary data page. Records that are displayed in green are complete. Records that display in yellow are not yet complete. Users can select any of the green records to view or edit saved data. Users can select yellow records to enter data for that particular reporting week. Records that have been previously saved will display a date created, which indicates the date the record was first created and saved. The last modified field refers to the most recent date edits have been made to the data in the data collection form. Line list data reports can also be downloaded using the Nhsn analysis and reporting function. To download data line lists, navigate to the Analysis tab from the left-hand navigation bar. Users will need to generate datasets prior to running a line list report to ensure that the reports include the most up-to-date data. To do so, select Generate Datasets, then Generate Reporting Datasets. Next, navigate to Analysis and Reports. Please be aware that reports containing healthcare personnel data are saved within 2 folders: COVID-19 Vaccination, which contains healthcare personnel data after the 10.0 Nhsn application release, beginning with the week ending 10/3, and COVID-19 Vaccination pre-10.0 for healthcare personnel data entered before the 10.0 application release. Reports can also be run for units within certain facilities, such as IRF and IPF units. After running a report, you can also see that an HTML report with the line listing of the healthcare personnel data will be displayed. For more information about creating and modifying line list reports for COVID-19 vaccination data, please refer to the quick reference guide linked on the slide. Nhsn regularly reviews data reported through the weekly COVID-19 vaccination modules to understand trends and to identify potential reporting errors. Data that were potentially entered in error are flagged by the Nhsn application and displayed as a data quality alert on the application landing page. Users will see these alerts when logging into the healthcare personnel safety component, or can access the alerts by selecting Alerts from the left-hand component menu. A table with information about the quality assurance alerts will be displayed, including reporting week from which the alert is referring to, and a descriptive information about the QA flag that has been generated. By selecting the pink QA alert icon, users will be redirected to the data collection form to review and edit their data accordingly. A current data quality alert in the Nhsn application generates if vaccination rates for a reporting week are less than or equal to 10%. This is calculated as the number of staff who have received any partial or complete vaccination series divided by the number of staff in the facility for that week, excluding those not eligible to receive vaccine due to medical contraindications. For more information about how to view and clear data quality alerts, please review the following resource listed on the slide. Please note that there is a recent defect associated with this alert. However, it has been resolved. The next few slides will outline some resources that may be helpful to you. Please use the link on the slide to access the COVID-19 modules and dashboards from the Nhsn homepage. The Healthcare Personnel Safety Component website contains links to a variety of training materials. The link on the slide will take you directly to the resources. You'll also see a tab on the web page to access FAQs. CDC has created a tables of instructions document that provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into Nhsn. If you have any questions about Nhsn, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of the email, along with your facility type. This concludes the presentation.